and thank you for tuning in to BTR's Newsbreak. I am your host, Karen Lett.
And I'm your host, Rebecca Smith.
In today's news, X-ray tech jobs are hard to come by due to the overabundance of students.
Well, that's a surprise when today's top story reads, Lives Put at Risk by Lack of X-ray Facilities.
According to this story, 9 out of 10 hospitals lack round-the-clock access to staff and equipment capable of providing interventional radiology, which saves lives even though the facilities are cheaper and less risky than conventional surgery.
X-rays, CT, ultrasound are used to guide an instrument to a specific site to halt internal bleeding, destroy tumors, and open up blocked arteries.
This technology allows radiologists to treat injuries and disease as well as diagnose patients and thereby avoids risks that are involved with surgery.
Interventional radiography is not widely used, even though it cuts costs and prevents deaths, particularly among new mothers with postnatal bleeding. Somewhere in the country, someone is going to die or have serious injury because facilities are not available. The patient will either get conventional surgery or nothing.
If you have a patient with severe internal bleeding, they will be in shock. If the surgeon opens the abdomen, the procedure adds to the shock. The risk is increased by the surgery. Using interventional radiography allows you to insert an instrument through an artery in the groin, find the bleeding point using a radio-opaque dye, and block the artery more easily.
Interventional radiography should be used or made available in all hospitals with delivery units to give the lives of mothers with postnatal bleeding.
Not only were the benefits of patients interventional radiography proved with who have internal bleeding, tumors, and blocked arteries, but the financial savings for treatments of fibroids as well. A hysterectomy costs double that of interventional radiology.
Lack of availability of interventional radiography is putting patients' lives at risk. Some patients have died because the service isn't there, and patients will go on dying.
When a car crash victim is brought in with serious internal bleeding, doctors have two options. In the conventional approach, surgeons open the abdomen, find severed blood vessels, and repair it. There is the danger that the patient already in shock and will be unable to withstand the surgery. In the alternative approach, the interventional radiologist inserts a catheter through a pinhole incision in the groin and threads it through the blood vessel to find the site of the injury. A radio-opaque dye is released which reveals an on-screen exactly where the bleeding is occurring, and a stent is applied to effect the repair. The patient suffers less shock and has a better chance of survival, and the treatment is cheaper.
Well, that's amazing what new technology the medical field is leaning toward.
Not only is interventional radiography used to replace surgery, but has your back been bothering you lately?
You can guess on that. I haven't had it the same since I've had my car accidents many years ago.
Well, listen to the title of this story. Oh, my aching back. Give me a shot of ozone.
Did you just say ozone?
I said ozone. A minimally invasive interventional radiology treatment that safely and effectively uses oxygen and ozone to relieve the pain of herniated disc.
Back pain is the most common cause of job-related disability and is leading contributor of missed work.
Well, oxygen and ozone therapy involves injecting a gas mixture of oxygen and ozone into a herniated disc. The treatment can limit pain and inflammation by reducing the disc's volume. Oxygen and ozone treatment of herniated disc is an effective and extremely safe procedure. Interventional radiologists use imaging to guide a needle to inject the oxygen ozone into injured discs. Complications of the procedure are less than 0.1%, and recovery time is shorter for the oxygen ozone injection than a discectomy.
Ozone shrinks disc volume. This is why it is pain relief. The vertebrae from the back are cushioned by small, spongy discs. When the discs are healthy, they act as shock absorbers. When discs are damaged, they may bulge or break open. Surgery on the disc or discs may cause a lot of associated complications.
Well, most of the research for the oxygen ozone treatments have been done by interventional radiologists in Italy.
I'm sure in the next few years that this will become part of the United States process as well.
Well, speaking of the ozone, the 3-day weather forecast is up next, but a few words from our sponsors.
Have you ever had an upper GI or an esophagram? Remember that chalky, gagging barium drink that you had to chug down? Well, listen up. New Smith-Lett barium will change your way of tasting. Our new barium is so tasty, people are drinking our new barium as a milk. Now available at your local pharmacies in new grape flavors such as cherry, orange, and grape.
Got barium.
And now the BTR Newsbreak weather forecast. On Monday, when you wake, morning brings many barium enema exams scheduled. By early afternoon, upper GIs and small bowels begin to fill the afternoon. And by evening, small bowels continue into the early evening and will finish around 10 p.m.
Tuesday we're going to start our morning routine with a retrograde pilogram scheduled at 8 a.m. Early afternoon, a windy late afternoon causes an ERCP to be added on to the surgery schedule. Around 5 p.m. evening, a tornado sighting causing patient falls and leads to a massive amount of late hip pinnings.
And for Wednesday, early a.m., there are complete lumbar spine x-rays that fill the a.m. due to late sleepers. By noon, the workload increases and causes an abrupt schedule of thoracic spine x-rays. And into the evening, due to the decrease of temperature and wet road conditions, the rest of the evening into early Thursday morning is filled with trauma C-spines.